Hey, I'm Brent and I'm with Banana Split. This is Banana Split. Karina's over there somewhere. Alright, and we're gonna discuss some topics with you guys today. Discussing the integumentary system, wounds, how to prevent wounds from happening, and how they heal. So listen up and maybe we can help you learn something today.
Okie dokie. The integumentary system is the organ system that protects the body from various kinds of damage, such as loss of water or abrasion from outside. It is a complex organ that performs many different functions. The functions are: acts as a mechanical barrier, keeps harmful substance out of the body, and helps retain water and electrolytes. Protects the internal structures and organs from injuries caused by blows, cuts, harsh chemicals, sunlight, burns, and pathogenic microorganisms. Participates in the immune response against invading microbes by housing specialized cells called dendritic or Langerhans cells, and performs an excretory function. Acts as a gland by synthesizing vitamin D when exposed to sunlight. Performs a sensory role by housing the sensory receptors for touch, pressure, pain, and temperature, and plays an important role in the regulation of the body temperature. The skin is called the cutaneous membrane. Here's a little picture I drew. Let me try to zoom in. Oh, probably shows all wrong, but it is the largest organ in the body, and it has two distinct layers. The outer surface layer is the epidermis, which is that little top section over here, and the inner layer is the dermis, which is this one right here. And the dermis anchors on the subcutaneous layer, which is this part right here. So this is the integumentary system.
Okay, and I'm going to explain to our patients how wounds occur. A decubitus ulcer is caused by impaired blood flow to bony prominences, and you can get that by laying in the bed too long or not shifting your weight in a chair. A stage 1 has slight redness or discoloration that won't go away after the Blanch test. Stage 2 is partial thickness skin loss that may look like an abrasion, a blister, or a shallow crater. Stage 3 is full thickness skin loss that looks like a deep crater, and it may extend to the subcutaneous tissue, and it can be damaged or necrotic. This is often has bacterial infections with it. Stage 4 is full thickness skin loss with extensive tissue necrosis or damage to muscles, bone, or supporting structures. Infection is usually widespread in this stage 4 ulcer. An unstageable is loss of full thickness tissue. The base of the ulcer is covered by a scar, which in a scar may appear dry, black, with a buildup or tough necrotic tissue, or it can appear wet and oozing. And scars can act as a tourniquet and cut off circulation to extremities. It can also harden if it's around the thoracic cavity and impair breathing, which can cause death. And a scarotomy has to be performed. This is the cutting of the scar to relieve pressure around the extremities or the chest cavity to reduce symptoms. And I have pictures of my stage. Stage 1, it would be red just at the epidermis, the superficial layer. Stage 2 goes a little further down. Stage 3, it can start getting into the subcutaneous layer. Stage 4, it can reach to the bone layer, and stage 5, it can reach to the bone layer, but it will also have that as scar covering over it that would need to be removed.
Okay. In general, infections can be prevented by washing your hands. It's the most important way to prevent materials. Appropriate PPE should be worn effectively. That includes putting it on and taking it off appropriately. If you take it off and you put it on the wrong way, it can contaminate clothing and the linens that can be spread to others. You must cover your hands when coughing or sneezing. Make sure to drink or eat appropriate foods. Make sure they're not contaminated, so you should cook them thoroughly. You should make sure all linens are cleaned and should be changed when they're needed. For wounds, they should be cleaned appropriately. The main thing is to use good hand hygiene. Area needs to be maintained sterile when cleaning. Pressure wounds can be caused from insufficient blood supply to an area. Patients should be turned every 2 hours, and they're also encouraged to shift their weight every 15 minutes if they're in a wheelchair. When irrigating pressure wounds, you need to remove all soiled materials, wash your hands, and then set up a sterile field. Effectively irrigate each wound until it's clean completely. Provide ointment if the doctor orders it, and it should be changed when and how the doctor orders.
Is that it?
Can you cut off some?